next speaker is Maggie Farrell. Maggie is the Clinical Operations Manager at Cedars-Sinai Comprehensive Transplant Center. Um, she's managing the kidney and pancreas programs. She holds a certification in both transplant and ambulatory nursing with over 20 years of experience. Maggie is experienced and a passionate transplant professional who advocates for and promotes advancements within the field. Maggie will be speaking to us today regarding understanding the kidney offers and staying active on the kidney transplant list. Everyone, welcome Maggie.
Good morning or almost good afternoon, and thank you so much for that introduction. If I may, I will put up my slides now. As stated, I'm going to talk about kidney offers and how do you stay active and what to do on the wait list. And not that this is news to many, but I wanted to make a point here that, of course, one of the challenges for patients awaiting transplant are a couple things. And the biggest one is the number of people that are waiting for transplants across the country. And our wait list, and this is, of course, all organ and tissue, waiting right now is over 113,000 people. And 96,000 are waiting for a kidney specifically. So this is, as I said, not news for this group, I'm sure, but I do want to point that out because it is reflective of how we think about how we manage ourselves on the wait list and what options we're open to. And secondly, of course, geographical location is another challenge. And what in whatever area you're living, the more populated the area, the longer the wait times are, and that's certainly a big giant challenge when it comes to wait times. So with that said, it's a daunting, it's kind of a daunting thought of living and waiting, and especially if you have a long time to wait. But I want to point out that there's big giant advantages, of course, of pursuing that challenge. We'll talk later about, understanding what you can do to minimize that wait time. But right now, just, the obvious piece of just realizing the efforts, the fruits of your efforts of getting through this process and waiting through the time is plentiful. And of course, for a patient's awaiting or getting a transplant, it frees you up from dialysis, obviously. It will inevitably increase and affect your energy level. It will provide fewer diet restrictions. It will lessen your fluid restrictions, if not at all. And overall better quality of life and physically just feeling better. And for those things, in and of itself, I don't know how we could make that sound any better, because those are really massive advantages for people that have kidney disease and are on, especially if you're on dialysis. So quickly, I want to go through the phases, and some of you are probably very, very aware of this, but phases of transplantation, again, looking like a daunting process, right? Looking like a very time-consuming process. But as we know, that the referral phase is what initiates someone's transplant course. Your doctor, your dialysis center, your social worker at your dialysis center gets that referral to a transplant center of your choice. That referral, again, will start your process, will open up your course here in whatever transplant center that you're going to. Once you get through your referral phase, you get into the evaluation phase, which is, of course, quite a significant effort in that you have to go through a lot of testing, a lot of clearances, a lengthy appointment with the team. It's a lot, but it is, again, you get in, you get these things done, and you get all of your work testing and your workup done. The transplant team is there to help you see through that. And then your presentation at selection committee is really the determining factor to ensure that you're a healthy candidate for transplant. And when that happens and you are determined a suitable candidate, you are listed on the national wait list, and that's United Network for Organ Sharing, otherwise known as UNOS. So those is an important piece to know, that once you're listed, you are listed on the national waiting list, and that is through UNOS. At that point, you become waitlisted, and you're now gaining time. And that's a big piece. Obviously, that's where we're going to be spending most of our time today, is the waitlist phase. In addition, there is that treatment phase for any patients that are highly sensitized, and I'll talk a little bit more about that later on. And then the transplant phase, and then a post-transplant phase. So when does the waitlist phase start? And again, that what I just reiterated there is just all your testing, all your labs, procedures, clearances, everything that the transplant team has directed you to complete has been done. It has been presented at the selection committee at your transplant center, and that multidisciplinary team who is designed to look and scrutinize your case to make sure that you are a suitable candidate, mostly meaning that you're a healthy candidate, that you can ensue this type of a transplant from every aspect of your life, medically, psychologically, socially. Every aspect is looked at by the selection committee team to make sure that you are suitable. Once that occurs, your name gets put on that national wait list. And how do you know your name is on the national wait list? Your coordinator at your transplant center will call you and tell you. And those are great. As a transplant coordinator, believe me, we love making those calls. There's no better information to give to a patient who's gone through, the evaluation and all of that goes with it, to be told that they are now officially listed and that they're gaining time. It's a gratifying call to make, and it's really obviously for the patient's side a very happy call to receive. You will also get a listing letter. So that listing letter, we are mandated as a transplant center to provide patients with a listing letter confirming that you have been listed on the national wait list. I really want to put an emphasis on this last piece here. If you have not received that letter, then you should not assume that you're listed. And patients oftentimes, I hear it a lot, they come for their evaluation appointment and they feel or they think that they're listed already. And that's a really big misunderstanding. And we have not been clear to the patient that that is not in fact the case, and is not the case until you receive that letter and that call. So if anybody has questions on whether you're listed or not, it's a very simple call to your transplant coordinator to confirm. So now you're listed. You hit the first goal line, you're there. Now what do you do? So for us, here in Los Angeles, there's an ample amount of wait time for all blood groups waiting for a kidney, as we discussed. Los Angeles is one of the longest waiting times. So what do patients need to do in order to keep themselves transplant ready during those years that they're waiting? And the biggest things that patients can do is making sure you're keeping yourself healthy as much as possible. There's a lot that comes with renal disease. There's a lot that comes with the emphasis or the unfortunate effects of dialysis, and we completely understand that. I think keeping yourself as healthy as possible by keeping really close contact with your nephrologist. So how are you managing your dialysis? How are they managing the effects or side effects, I should say, of your dialysis? Understanding what those are and how to make those better. Those are key, because dialysis we can't do without until you get your transplant. So we have to make sure we maximize that. Your nephrologist is the main player in that equation. Also following dietary and your fluid restrictions, massive importance in that, because of course any fluctuations in what you're eating or not supposed to eat, or fluid, can in fact negatively affect how you are managing your dialysis and the symptoms thereof. In addition, your dialysis schedule and the dialysis, the adherence to your schedule, the adherence to that time is really, really important, not only by way of the number of days of the week that you're supposed to go, but the number of hours per day and per session that you're supposed to attend. There's really significant relevance in managing your fluid status by that key. Also, we tell patients to keep yourself what we are calling always ready. What does always ready mean? We're going to talk a lot about that during my session today. But patients now become responsible for becoming always ready and staying always ready. And then know when your wait time started. So another misnomer out there is when wait times start. For patients, it's very important to know when the clock started. If I'm the patient, I really want to know that. And when does the clock start? It starts either by the beginning or the initiation of your dialysis, or if you were not on dialysis, when you were placed on the national wait list. So if someone comes to us today with 5 years of dialysis time and they're brand new being evaluated at our center, and they actually make it through their evaluation, get listed, they're actually going to get that 5 years of dialysis time. And that's where the clock starts, is 5 years prior. So I always want to make sure that patients are aware of that, because that's really a big, big piece, that you do get that dialysis time. What can patients do in addition while you're waiting is the collaboration and the relationship with the transplant center. And I will say that that is a key element. The transplant program is obviously there's many tentacles to the transplant program, but understanding who your team is, what they do, having good communication with them is a massive, massive benefits to patients. So we're a transplant team basically is a group of your healthcare professionals who are by your side to assist you before, during, and after your transplant. They're comprised of multidisciplinary providers. So you have, and you probably saw at your evaluation appointment, you surely saw a nephrologist, you saw a surgeon, transplant surgeon, you saw a dietitian who specializes in transplant, a financial coordinator, social worker, nurse coordinator, and as well as administrative assistants. These are key players, all of them, of course, and they're all have an evaluation of your candidacy and have a weigh-in at that selection committee that we spoke of previously. Now, I've highlighted the nurse coordinator and the administrative assistants on this slide because certainly once you are seeing an evaluation and you're going through the evaluation, or you are waitlisted already, these two team players are your keys. They are the people that you want to stay most connected with. And why is that? Your nurse coordinator is, for all intents purposes, the core is kind of the center point or the nucleus of your workup or your wait time, because they're the ones ensuring that everything that needs to happen is in motion and is for your benefit, is in motion. So having a close communication with that nurse is huge, as well as the administrative assistants. So they are a massive player in scheduling tests and studies, communicating with the patients and making sure that they know what to do and where to go, and also just a collaborative communication component that really is, I can't put enough emphasis on that. So as I said, know your nurse coordinator, know your administrative assistant. Those two team players work as very close together. They direct and guide you through the complex transplant workup and or waitlist phase. They will keep you updated on your status, and they'll keep you educated, which is a huge, huge role of a nurse coordinator, is the education piece, particularly in transplant. It can be very daunting and confusing. It can be overwhelming, and the nurse coordinator is your friend to make sure that we are keeping you educated and knowledgeable about what you need to do, what options you have, uh, a number of things that really we as nurse coordinators should be making sure that you're taking care of throughout the different processes. So what I want all patients to do, if you haven't already done that, please know who your coordinator is, what their name is, know what the administrative assistant's name is, and for sure have their contact information. So the best thing is an email address if you communicate that way, a direct phone line, and or EMR communication. So depending on what electronic medical record that your transplant center uses, you can have direct access to communicate over that EMR with your providers. And for our center, we do a lot of, we're on Epic, and we do a lot of communicating with our patients via that route, and it's very effective. They can type us a question, we can type it right back to them, and it's a very quick, easy way, and if you don't require a phone call. But all I ask is that each patient knows who their coordinator is, who the team players are, and have a contact information so that you know how to get the answers that you need. And then, of course, stay in close contact with those guys and ask questions anytime, at any phase. The questions are welcomed, because the questions being brought up really prevent misunderstandings, prevent things being lost in translation. Please bring your questions to us anytime. So what else can patients do? Of course, while you're waitlisted, another key component is doing or attending your waitlist follow-up appointments. And of course, waitlist follow-up appointments differ from, depending on what center you're at. So for our center, I can speak to the fact that we wait until patients get within a few years, 3 to 4 years of coming up of their wait time. So before you get to seeing your names on active organ offers, about 3 to 4 years before that happens, we want to bring you back in. We want to make sure that we take another look at you. We want to make sure all your tests and studies are up to date, that you haven't had any new health issues or complications. And we basically go through almost a whole evaluation appointment again during that waitlist appointment, which again can seem like a lot to patients, and I completely understand that. But there is massive advantages to coming back in. There's massive advantages to being reevaluated by that multidisciplinary team that we spoke of earlier. So it is consultations with all the team members to ensure that you remain healthy and ready for transplant. It is very important, because given a face-to-face opportunity to have your questions answered for me as a patient in my own world is really, really quite beneficial, particularly when we're talking about a specialty like transplant. And I always say to my patients, please write those questions down. Write all your questions down, your family's questions, your friends' questions. Write them down and bring them to us on your waitlist appointment. If you don't have a waitlist appointment, call us with those questions. During that appointment, we will also determine your antibody status or changes in your antibody status. And we'll talk a little bit more about that in a little bit later. We'll review the different types of organ acceptances, because there is also later in my talk, I'll talk about organ utility and how the transplant world is really trying to utilize organs and prevent organ wastage by way of additional deceased donor organ types. So all those need education, explanations, and consenting. And during this appointment is a key piece to do that. You'll also have, as I mentioned earlier, updated tests, updated studies, laboratory testing, all of that done usually within the same day of your waitlist appointment. If you require additional imaging, specialty clearances, other testing as indicated, to work up your own personal medical history, then we'll send you out and help to coordinate those after your appointment. So remember, anytime people have any kind of medical history, whether you have a cardiac related problem, pulmonary problem, you have a liver dysfunction, you have anything that you have historically had, we want to update the evaluation of that. Or if you have a new problem, and there is no simple new problem, meaning there is no problem that we don't want to hear about. Anything that you had a blood clot last year, you had a blood transfusion last month, you had anything that occurred is important for the transplant team to know. So please remember to always write down your events as they've occurred and make sure you're either telling your transplant team at your appointment, or again, if you don't have an upcoming waitlist appointment because you're not at that time point yet, then call your coordinator and let them know that. We also require blood samples to be provided on a regular basis, and those blood samples are usually collected at your dialysis center or at your doctor's office. And the whole purpose of those blood samples is massive, actually. They get collected and they get sent to the transplant centers and then ultimately sent on to the Organ Procurement Organization laboratory. Those blood samples being on hand are what is used to do cross matches with the donor blood when your name comes up on an organ offer. It is imperative that we have an up-to-date blood sample. If we don't have a blood sample, it's complicated. It's time that we need to get the sample from you, to get it to the OPO lab, to get the cross match done. And I'll be honest with you, in some organ offers, we have time for that, and in other organ offers there is no time for that. So I want to place a big emphasis on this because this is a huge key to making sure that your blood samples are done regularly as the transplant center has indicated, and really the people that are helping you do that is the dialysis center or your doctor's office. So as mentioned, there is a huge benefit in keeping your team up to date. And life happens, things change in people's lives, and all of those life changes most of the life changes are things that we need to know about. We are happy with where there's marriages and babies and grandbabies and a lot of wonderful life events that occur that are fantastic, and we love to hear about that too. But the imperative pieces that are extremely important to know, we're going to go through here. So calling your team if you don't have an appointment, or reviewing this during your waitlist appointment. Updating address or phone number changes. Hugely important with the emphasis on phone number changes. If your phone number is not active or accurate and there's no way for us to get it, the chances of us reaching you when an organ becomes available is second to none. So if I could ask anybody and everyone, please, to make sure that your phone numbers are accurate with your team. And then, of course, any changes in your emergency contact. So let's say you did change your phone number and you didn't tell your transplant team, but we could call your emergency contact and get you by way of that person. That's great. Let's hope the emergency contact is intact. Let's hope that emergency contact is still your emergency contact and their information is still accurate. Those are two lifelines right there. We also want to know where or if your caregiver changes. So most everyone knows here that, you know, in order to get listed, one of the qualifying things is that you have a valid caregiver and a backup caregiver that will take care of you and help take care of you once you're transplanted. So our social workers do a really intense evaluation of who these people are. They have to actually call them and interview them, and it's really a big commitment that there are going to be a primary person and a backup person available to you whenever that call comes. Those people are huge. We get them not only involved in your teaching before you even get discharged from the hospital post-transplant, they're involved in the teaching. They're involved in your follow-up care. They're involved in driving you, helping you with your medication, preparing meals, etc. There are big players on your team as well. If your caregiver changes, please make sure you call us and let us know, because the social workers will need to vet that new caregiver that you've identified and make sure that that gets changed in the medical record. Insurance changes is the next bullet here, and that is also critically important. If your insurance changes, we need to know immediately. So, for example, if you do not allow us to understand that you have an insurance change and you receive an organ offer, the first thing that we do when we get an organ offer is have our finance team validate that your benefits are up to date and that we can bring you in should this organ come to you. If that insurance is no longer valid, it puts a big crimp in the whole process. Now we're going to call you and we're going to say, your insurance is no good. Did you change? And you're going to give us your new information. But again, time is of the essence in many organ offers, and you don't want that turbulence, because it may be, you know, if it's a managed care plan and we need an authorization, we're going to be hard pressed to get that at the 9th hour. So point being is, insurance changes need to be reported as soon as they occur. Also, anything new medically, any new medical condition, any new psych or psychiatric condition, anything like that should be reported to us as well, or new medications that you get put on. Really helps us to determine if there's anything further that we need to do to make sure that you remain a suitable candidate. And new medications, you know, may seem benign, but they really are not. For example, let's pretend that you had a blood clot. Patient had a blood clot and was sent home on a blood thinner to be taken for the next however many months or years. Some patients don't feel like that's a big thing to report, but I'm here to tell you that that's a massive thing to report. So there is no medication that we don't want to hear about. Please call us and just tell us what happened. Tell us about your new medication. If you were hospitalized, why you were hospitalized, where, how long you were hospitalized. Huge. The other thing is important for us to know is if you didn't initially have a living donor come forward on your behalf, but now, say 3 years later, on the wait list, you do. We want to know that, and we want to get that living donor put through and evaluated to see if we can have that particular donor donate for you. So that's a big thing to tell us, because if you call us and tell us that, we will streamline the process for that donor to come forward and be evaluated. The other big piece is telling us if you've had a blood transfusion. Any blood transfusion that occurs, and I'll talk about this a little bit more later, but blood transfusions are important because they can change your antibody status. Antibody status can change how you're matching with potential donors. So really, really important for us to know all these components. There's not really one that's more important than the other. I'll be honest, all these are critically important for us to know. Okay, so my next focus is just staying informed, right? Patients staying informed is key. for all of us in the healthcare can be complicated. So really educating yourself and really understanding what you're doing within whatever field of medicine that you have a focus of is really imperative. So I spoke earlier about UNOS and the United Network for Organ Sharing. I want all patients to know that is UNOS operates our nation's organ procurement and transplant network. They help facilitate and oversee the organ recovery and organ placement under the contract with the U.S. Department of Health and Human Service. So UNOS is the governing body overseeing transplant. Also, a huge element of concern is the kidney allocation, right? How kidneys are allocated. And now they're allocated to local areas first. Then they are sent to regional areas, and then they are sent nationally. And that's the order in which organs get allocated or offered to different transplant centers. It's also based on blood type, of course, waiting time, and sensitization status. So continuing on, staying informed, we have a nationwide organ shortage. We all know that. That's affecting the amount of time that patients have to wait to be transplanted. So how do we manage that? A number of things, but of course, and some of which we've already talked about, but one thing is improving organ utilization, and that's a nationwide focus right now. And what do I mean by organ utilization? We're trying to maximize the number of organs that are out there potentially and reduce the organ wastage. So I want to go through briefly what those options are with you, if I could. So types of deceased donors. We have donors that are donate after after brain death. That's your standard brain dead donor. Those organs are being procured from that patient while the patient is still on life support. So meaning the blood supply is still going to those organs, and this is the standard manner in which we procure organs. Donation after cardiac death is different in that this particular donor has some minimal brain function, so they cannot be technically labeled brain dead, but their expectancy of survivability is nil. And therefore, their family has made the determination to proceed with organ donation, and those organs are not procured until the patient has actually passed. So that circulation that we spoke about in the prior situation is compromised in these types of patients. However, massively utilized across the country now. We also have risk criteria that is important for patients to know. Risk criteria basically means that all donors are evaluated for risk factors for HIV, hepatitis B, hepatitis C infections that have occurred within the last 30 days, and all donors will be tested to that. Recipients will be notified if the donor meets any of the risk criteria prior to acceptance and transplant. And there is actually this is the key bullet here, is that effective therapies are now available should transmission occur. And the most recent development is hepatitis C infections and the utility of hepatitis C organs. And we'll talk about that a little bit more. So Hep B donors, they're donors that have been exposed to hepatitis B somewhere in their past. There's a very, very low risk of transmission for these types of donors. However, you may need to take a medication after transplant if this type of donor is utilized as a precaution. Hepatitis B donors have been used fairly widely for a number of years now, versus hepatitis C donors. So Hep C donors, and these are now the second bullet here is about a hep C donor that does not have active infection. Okay, so these donors do not currently have hep C at the time of donation. These types of donors provide a risk of developing hep C to a recipient in less than 1%. These types of donors have been used for a bit of time now and have been successfully utilized. My next bullet on a hep C donor is actually donors that have active infection. So it's a donor who has active hep C infection at the time of donation. These are now being utilized more widely because why? Because we have an active treatment for hepatitis C. And that was a game changer when those meds came out in the transplant world, or came out in the world at all, because it helped patients that were living with hep C. And now it's helping us utilize donors that had active hep C. So there's a 95% chance of becoming infected with hep C if you accept a hep C donor. Current treatment is typically more than 98% effective to cure infected individuals. It's huge. That is huge. And of course, you will need to take medication and complete additional testing post-transplant. Those medications are not lifelong. Those are for a period of time post-transplant. Both of these options, all three of these options, I should say, are things that your transplant center should be talking to you about and giving you the opportunity to be educated about it and to determine whether this is something you would like to understand or entertain once you have an understanding and knowledge of these options. In addition, if you're a blood type B patient, some transplant centers utilize what we call A2 to B transplant, and it's otherwise would be considered incompatible, an incompatible transplant. But a blood type B recipient could receive an organ from a blood type A kidney. In order to go through this process, you may require IV medications and or plasmapheresis pre-transplant in order to treat your titer levels and get you safe to transplant. This is a huge piece for patients that are blood type B. Not all centers do A2 to B transplants, but what I would encourage is actually to ask your center if you're blood type B, ask your transplant center if this is an option for you. Next is high KDPI kidneys. So UNOS gives a score to all donors based on a number of factors. The higher the score, the more the risk is with that donor. So KDPI donors greater than 85% is what we formerly called extended criteria donors. That was in previous terms, UNOS terms. That term is no longer used, and we use high KDPI, and it's basically a KDPI score of 85% or greater. Those are utilized in patients who are less able to remain on dialysis for a long period of time, or who don't have a lot of wait time accumulated. So let's say you're an older patient and you don't have dialysis time, and you don't want to wait in excess of 7, 8, 9 years for a kidney if you're in Los Angeles. Then this may be a good option for you. And I would encourage people to talk to their transplant centers if you haven't already done so. Transplant centers should be offering this option to patients over 45 years old. If you acknowledge that you want to proceed with this option, it does not preclude you from or prevent you from getting a standard offer as well. And basically the difference in standard offers and a high KDPI offer is it's what we call a marginal donor. But marginal donors basically mean that donor had a history of hypertension, they had a history of diabetes, they had a stroke, and their age was an older age. However, that might not sound beautiful, but I will say that transplant centers scrutinize these donors heavily, including receiving a kidney biopsy from that donor. The donor biopsy really is what is one of the big factors in helping the team determine whether that high KDPI donor is acceptable for you or not. It gives us the pathology on that kidney and its utility. So again, this is a very good option for patients that are greater than 45 years old and don't have a lot of wait time or who are not doing well on dialysis. All the options that we just discussed, the hepatitis options, the A2 to B option, the high KDPI option, those all require education from your transplant center. They require your consent. So at either a phone call to your coordinator or at your waitlist appointment, make sure these are the questions that you ask if you haven't already done so, because you absolutely have to consent for these things. You will not automatically be subject to receive offers, which is in fact extending the organ utility by way of utilization of these offers, these organs that are found to be very, very safe. So I mentioned I would talk a little briefly about antibodies, and I know that some of you may know this piece, but I want to just review it quickly. Antibodies and transplant, they can be conflicting, colliding issues here. So have you ever been informed that you have high antibody levels? Basically, antibodies are proteins that circulate in your bloodstream, and they are part of our immune system. Where do we get antibodies? They can be caused by a pregnancy, they can be caused by a blood transfusion, or a previous transplant. So ask your transplant team if you think you have antibodies, because if you do, the next question is it hindering your ability to receive an organ offer? If you have high antibody levels, it could be causing what we call positive cross matches with organ offers that aren't acceptable. So it may be increasing your wait time, in other words. There are therapies out there available at certain transplant centers, and that's really important to know. If you have high antibodies, make sure you understand, A, that you have them, and B, if there are options available at your transplant center to help lower those antibodies. Our center at Cedars has a very robust antibody program. However, there are centers across the country that have robust antibody programs, and there are centers across the country that dabble in it, and some that are not involved in it at all. So it is a very significant question to ask. So next focus I want to talk about is that always ready. Be always ready for that call when it comes to you. When a deceased donor organ comes available for you, the last thing that we want to do is not be able to find you. And as we talked about earlier about those, having up-to-date numbers and, contact information and your emergency contacts, et cetera, it is really, really important. I will tell you that we've had many scenarios where we can't find people, unfortunately, and those scenarios where we can't find people have resulted in that patient losing out on that organ. And believe me, Mike, our coordinators will jump through many hoops to find you. They will jump through many, many hoops. We've called everybody on your contact list. We will call your dialysis unit. We will call the police department if we have to. We've dispatched officers many, many, many times because somebody wasn't answering. Somebody couldn't be reached or found. And we've actually, believe me, sent out policemen who have found the patient at home and the patient's phone just happened to be on silence or not charged or et cetera. So please do me a favor, and those key things are huge to always be on the front of your mind. So when that offer comes to you, you're going to be called by the transplant team. You're going to be given instructions on what to do. I promise you that call can come during the day when we're all awake, or it can come in the middle of the night when we're all asleep. And believe me, that's the hardest time to find people, because people are sleeping and not everybody has like a blasting ringtone on their phone. But I highly recommend have a blasting ringtone on your phone, because you don't want to miss that call. And it could come at 2 o'clock in the morning. It could come anytime. It's imperative that we're able to reach you 24 hours a day. Your call, very important, your call may come from a number that you don't recognize. In fact, it's likely going to come from a number that you don't recognize, or a blocked call. We've got our transplant coordinators, they work 24 hours a day. They are up fielding organ offers. That's all they do. We have a dedicated, at least at Cedars, we have a dedicated call team. That's all they do is take organ offers, scrutinize them, work with the nephrologists and surgeons to make sure that that's acceptable, and then they're calling patients, either preemptively giving you a heads up, this may come to you, stay close by your phone, or this is coming to you and we need to bring you into the hospital. Those are critical calls, guys. So always, if you don't answer it because it's a blocked number, please just always answer or listen to the message, because that'll get you calling back quickly. If we cannot reach you, like I said, we may have to decline an organ offer on your behalf, which would be really, horrifically awful in many, many ways. So please let us be able to get you. I always say, have your belongings ready. Have that list of things, or even just the list of things that you want to take with you when we call you. Have it ready so that you can say, boom, 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 5 minutes, you're ready to go. What are those things? Your insurance card, your ID, your belongings, like your cell phone, if you want to bring that, if you want to bring a change of clothes, your medication list. Hugely important to bring your current medication list. Have those things ready. Don't bring valuables with you, and there's no need to bring your medications with you. Your medicine list will do. So you could be called into the hospital. We call these false alarms. But you could be called in for an organ offer because we think it's going to go to you. But then something happens and the offer falls apart. And we have to send patients home often because of scenarios like that. It's very disillusioning for the transplant team to do, but it's more disillusioning for the patient. That's a very, very disappointing message, to get the team coming to your room while you're already admitted to say, this isn't happening today. I'm so sorry. We're going to discharge you. False alarm right there. But we could say it as a negative, or we could say it like a positive, and it was a dress rehearsal. And that's what we always tell patients. This was a dress rehearsal. You know what to do. You know where to go. You know how it's going to happen. So you're going to be even better, more prepared the next call. So in short, transplant is, and I only covered a very, very, small part of the transplant phases, which is the wait list, but it's a collaborative effort for sure. And the biggest piece, if I haven't already emphasized it, is that you are the most important. The patient is the most important part of this process, and that the team is here for you. We want to get you to that finish line, and we want to be part of that journey. In fact, we will be part of that journey for you for life. Certain centers stay with you for life. Certain centers send you back to your nephrologist after a few months or years. At Cedars, at least up till now, we get to keep all of our patients, and we in fact see them through their immediate post-transplant course, and then we have them get back to their nephrologist. But we never get rid of our patients, meaning we want to see you once a year. And there's just huge value in seeing a transplant center once a year, even if you're 10 years out from transplant. There's changes in the transplant world all the time. There's different therapies coming through. There's different schools of thought. There's different research that has happened that's proven different treatments. So we really want to stay in touch with you. But you and the transplant team is the winning combination here. And that lastly, receiving a kidney transplant is a lifelong commitment. It really is. And we want to be there to help you make sure that it gets properly taken care of and that you live your best life. Thank you so much for having me, and I'm very happy to answer any questions that you may have.
Maggie, thank you so much for that presentation. Very informative. I think the takeaway here is to make sure that you have contact with your transplant team. That's the biggest thing here. And I think a lot of the questions that we have in that we've received too actually probably would refer back to some of those. I did want to actually mention one or two of those questions because I know we're short on time. Is to one of them is that we had a person asking regarding the new calculations or standards for the GFR for African American patients, and how does that affect their wait time, and how will they find out about it, and how and will they be informed that they've either added years or well really added years because of that calculation?
Well, great question. So this is a big endeavor that transplant centers took, and it's a massive positive change for our patients in most cases. So what you should do, in short, is talk to your coordinator, because you should have already gotten a letter. All transplant centers were required to send out letters to all patients on the list, not just African American patients. Everybody on their wait list needed to be informed that this change occurred and that what the process was going to be for that center to go through this. So if you didn't receive that letter, I would 100% call. If you received the letter and haven't heard anything since, call, because what transplant centers are doing now, and probably likely gone through the majority of their lists, is gone back to see if there's any qualifying EGFR that gains you more time on the wait list. I will tell you, our experience at Cedars has been incredible. We had multiple patients, more patients than not, that actually had gained time over this process. And a good amount of those patients were transplanted already after those changes were made, which is incredible.
Mhm.
So thank you for asking that. It's a very imperative question, and I apologize for not addressing it earlier. Talk to your coordinator where they're at. Have you been looked at? Have they found a qualifying GFR? If they have not, how can you help them find a qualifying GFR
Right.
so that that change can happen?
Mhm. Great, thank you so much. And so, yes, thank you, everyone. I do just want to say again, I think the big takeaway here is please contact your transplant centers. I know that we have difficulty here with our patients not understanding where they are, what they need to do, and that we really encourage you to make sure you get those contacts. Thank you so much, Maggie. Thank you so much for your presentation. And we are going to move on.
And a shout out to our corporate mission partners for making this happen.